Essential management and supervision skills for practical nurses. Understanding management and supervision. Management and supervision represent essential skills that practical nurses use to coordinate patient care and oversee support staff effectively. Management, planning, organizing, directing, and coordinating patient care activities. Supervision, overseeing the performance of delegated tasks by UAPs and LPNs under RN supervision. LPN management responsibilities. Ensuring quality patient care delivery. Delegating and supervising UAPs appropriately. Assisting in clinical decision-making processes. Communicating effectively with healthcare team members. Leadership styles in nursing. Different leadership styles suit various situations and team dynamics in healthcare settings. Autocratic leadership. Leader makes all decisions with minimal team input. Best used in emergency situations requiring quick decisions. Example, managing a cardiac arrest response team. Democratic leadership. Encourages team participation and collaborative decision-making. Effective for policy changes and quality improvement initiatives. Example, leading staff meetings to discuss new procedures. Laissez-faire leadership. Provides minimal direction while allowing team autonomy. Works well with experienced, self-directed staff members. Example, supervising experienced UAPs during routine care. Transformational leadership. Inspires and motivates team members toward excellence. Effective for implementing evidence-based practice changes. Example, leading initiatives to improve patient safety outcomes. Prioritization in patient care. Effective prioritization ensures that the most critical patient needs receive immediate attention. Priority framework. High priority, life-threatening conditions requiring immediate intervention. ABC assessment, airway, breathing, and circulation issues take precedence. Acute over chronic, new-onset conditions require attention before ongoing issues. Unstable over stable, patients with changing conditions need frequent monitoring. Practical example. Patient with new-onset difficulty breathing, priority 1. Stable post-operative patient requesting pain medication, priority 2. Diabetic patient with blood sugar of 140 mg per deciliter, priority 3. Time management strategies. Effective time management enables nurses to provide quality care while maintaining efficiency. Time management techniques. Plan ahead, review patient assignments and prioritize tasks early in the shift. Set clear priorities, address urgent needs before routine activities. Cluster care activities, perform multiple tasks during single patient visits. Delegate appropriately, assign suitable tasks to UAPs when possible. Minimize distractions, avoid unnecessary interruptions and time-wasting activities. Delegation principles for LPNs. Licensed practical nurses can delegate certain tasks to unlicensed assistive personnel while maintaining accountability. LPN delegation authority. Delegate appropriate tasks to UAPs within their scope of practice. Ensure task completion meets established standards. Report significant patient changes to RNs and physicians. Provide guidance and support to UAPs as needed. The 5 rights of delegation. Right task, appropriate for UAP scope of practice. Right circumstance, patient condition allows safe delegation. Right person, UAP has necessary competency for the task. Right direction, clear, specific instructions provided. Right supervision, adequate monitoring and follow-up ensured. Appropriate delegation to UAPs. Understanding what tasks can be safely delegated helps ensure patient safety and appropriate care delivery. Tasks LPNs can delegate to UAPs. Taking vital signs on stable patients with normal parameters. Assisting with bathing, dressing, and personal hygiene. Ambulation and repositioning of stable patients. Collecting non-invasive specimens such as urine samples. recording intake and output measurements, tasks that cannot be delegated, medication administration and IV therapy management, patient assessments and care plan development, sterile procedures requiring clinical judgment, patient education and discharge teaching, management of unstable or complex patients, managing conflict in healthcare. Conflict resolution skills help maintain positive working relationships and effective teamwork. Common causes of workplace conflict: miscommunication between team members, role confusion and unclear expectations, unequal workload distribution among staff, personality differences and communication styles. Conflict resolution strategies: address issues early, prevent small problems from escalating. Use active listening, understand all perspectives before responding. Stay professional and objective, focus on facts rather than emotions. Seek mediation, involve supervisors or HR when necessary. Effective communication and supervision. Clear communication forms the foundation of successful supervision and team coordination. Communication best practices: be clear and direct, use simple, concise instructions that are easily understood. Encourage feedback, ask team members to repeat instructions to confirm understanding. Provide regular updates, keep staff informed about patient changes and priorities. SBAR for reporting. Situation: describe what is happening with the patient. Background: provide relevant patient history and context. Assessment: share observations and clinical findings. Recommendation: suggest appropriate next steps or actions. Legal responsibilities in supervision. Supervision carries significant legal responsibilities that LPNs must understand and fulfill. Legal accountability. LPNs remain legally responsible for tasks delegated to UAPs. Must follow facility policies and procedures consistently. Required to report errors and unsafe practices immediately. Must maintain ethical nursing practice standards. Consequences of improper delegation. Patient harm from inadequate supervision. Legal liability for negligent delegation. Potential loss of nursing license. Professional and personal reputation damage. Ethical considerations in leadership. Ethical principles guide effective supervision and management decisions in nursing practice. Ethical leadership principles. Patient safety priority: always maintain focus on patient well-being. Respect team members, value knowledge, skills, and contributions of all staff. Fair workload distribution: ensure equitable assignment of responsibilities. Report unethical behavior, address misconduct promptly and appropriately. Summary and professional development. Management and supervision are essential skills for safe patient care delivery. Licensed practical nurses must delegate appropriately while following up on task completion. Effective time management and prioritization improve care efficiency, while good communication and conflict resolution skills support successful teamwork. Understanding legal and ethical responsibilities is crucial for nursing leadership roles. Key takeaways for practice. Leadership skills developed through experience and continuous learning. Delegation requires careful consideration of safety and competency. Clear communication prevents errors and builds team trust. Legal and ethical responsibilities guide all supervisory decisions. Thank you for watching and learning about management and supervision concepts. These skills will serve you well as you advance in your nursing career and take on leadership responsibilities.